Bonjour tout le monde.
Hello, everyone.
Je vais commencer en
I will
français,
begin in
puis
French, and
then I'll say a few words in English. Donc, je veux d'abord saluer
I first want to
mes
salute
collègues,
my
premiers
colleagues,
ministres,
the premiers
des autres provinces
from the
et
other provinces and territories.
Aujourd'hui, il y a plusieurs
Today,
premiers
there
ministres
are
qui sont avec
many
nous,
premiers that are with us,
c'est une demande qui
and
est
it's a
unanime
request
de la
that
part
is
de tous les
unanimous
premiers
from
ministres
all
des
the
provinces
premiers
et des
from the
territoires.
provinces and territories.
On répète une demande
We are repeating
importante à
an
M.
important request to
Trudeau
Mr.
à la
Trudeau
veille
on the
du
eve
dépôt
of the
du budget
tabling
fédéral.
of the federal budget.
C'est urgent
It is
d'agir
urgent
pour
to act in order
augmenter
to
le
increase
financement
the
des
funding
soins de santé
of the
en
healthcare
augmentant
services
les
by
transferts
increasing
fédéraux en
the federal
santé.
health transfers.
C'est un problème qui peut
It's a
sembler
problem that might seem
technique pour plusieurs
technical for
personnes,
many people,
mais c'est pas abstrait.
but it's
C'est
not
très
an
concret
abstract issue. It is a
et
very
ça a
concrete
des
issue, and
répercussions
it has
majeures
major
sur
impacts on
les services qui sont donnés à
the
la
services that are
population.
given to the
C'est
populations.
aussi
It's also
une question d'équité
an issue of
entre les
equity
ordres
between
de
the
gouvernement.
levels of government. Right now, the provinces and territories
ont un problème très
have
important
a very important
de
problem
financer les soins de santé.
to fund
Le
the
problème
healthcare services. And this problem
a été empiré
has been
avec la crise de la
increased
COVID.
by the COVID
Et la
crisis, and
solution, on pense
the
que ça
solution,
passe
we
par
believe it goes
l'augmentation
through an
des
increase
transferts en
in
santé
health
sans
transfers
condition.
without any
Une des
condition.
craintes qu'on a, M. Trudeau a
One of the
déjà
worries that we have, and Mr.
parlé
Trudeau
de
has said that he wants to do
transferts
transfers that are conditional.
D'abord, on pense
First,
que ça respecte
we
pas
believe it does not
les champs
respect the
compétences des provinces et
authorities
territoires.
of the different provinces
Clairement,
and
la santé,
territories.
c'est clairement
It's
un
really,
domaine de compétence,
health is
des provinces et des territoires.
a provincial and a territorial authority sector, and it's important for them not to centralize and create issues,
de gestion
management issues in the Canadian Federation. Mr. Trudeau has told us and repeated to us in the last few weeks and months that he wanted first to take care of the pandemic and then the funding of the health sector, and we don't agree with him. We believe, on the contrary, there's some important decisions that must be taken now, because provinces and territories will also table their budgets soon, and we need to ask ourselves some questions regarding the services we're able to fund for the population. I give the example of Quebec, for instance. We have increased by 8,000 people the amount of caretakers in the long-term care centers, and now we're wondering how we can fund those positions in the coming years, and those are important decisions that must be taken in the coming weeks, and it's important that the government the federal government does its part. To explain quickly the problem that we're experiencing due to the impact of the population getting older and the impact of the new technologies and the medication, we have an increase in the needs of 5% per year in the health sector, where the federal government's contribution is only increasing by 3% every year. So year after year, the proportion of expenses in the health sector that is funded by the federal government is reduced, and we are currently at only 22%. That means that the provinces and territories are funding right now 78% of the health expenses, and the growth, the exceptional growth, it's the only spending position in the government, whatever the territory or province, that increases by 5% every year. So the problem is getting deeper and deeper year after year. So what we're asking, our unanimous request, is concrete, very clear, and we're asking for the federal government to increase its contribution by 22% to 35% of the health spendings. Concretely, this means that the health transfers would grow from $42 billion per year to $70 billion per year. So this is an increase of $28 billion per year. The first thing that we will do when we will look at the next federal budget is to see what portion of this increase of $28 billion was accepted by the federal government. The finance ministers of the provinces and territories, along with the conference board, have made some predictions and projections of the financial situation of the provinces and territories and of the federal government. And what we see clearly, and when we look at the data that are now in the documents, is that in a very short term this year and the year that is about to start, the federal government has an important deficit. But the most part of this deficit is attributable to non-recurring spendings during the pandemic. So as you see, in the coming years, if we do not change the health fundings, the federal government will eliminate very quickly its deficit. It will even move into a surplus position, and the provinces will accumulate hundreds of billions of dollars of annual deficit for the next few years. So there's really a problem of equity here that is raised, and Canadians, Quebecers, are sending about 40% of their income taxes to Ottawa, 70%, 60% in the provinces and territories, and the federal government is only funding 22% of the major financial issue that we are facing, which is the health budget. So we believe that our request is reasonable. It is a request that is unanimous once again, so it is not one or two provinces or territories coming together. It's all of us, all the provinces and territories. It is the number one priority. It is the number one problem that we are underlining, and we're saying to Mr. Trudeau, it's no longer time to have sweet talks, it's time to act.
Say a few words in English. Today, we'll all have the same message for the federal government. Now is the time to act and increase the Canada Health Transfer. It's essential to do so for those who need treatments across the country. If the federal doesn't increase the transfer, there's a risk provinces and territories won't be able to pay for all the services their population need. At the end of the day, it's the most vulnerable people who'll suffer. Provinces and territories are currently paying 78% of health costs, and this proportion increases every year. Health cost goes up 5% each year, whereas the federal contribution only increased by 3%. So we ask the federal government to increase its contribution from 22% to 35%. This request is reasonable. It's based on long-term forecasts. It's made by every premier of every provinces and territories. So, Mr. Trudeau, now is time to act. Merci. Thank you.
On passe maintenant la parole au Premier ministre de la Colombie-Britannique, M. John Horgan.
Thank you very much, Premier Legault, for that introduction to the challenges that Canadians face. I come to you today from the traditional territory of the Lekwungen-speaking people, Esquimalt and Songhees First Nation. I join with premiers from across the country, from different perspectives politically, from different regions, with different challenges. But we come together with one common purpose, to speak directly to Canadians about the importance of protecting our public health care system now and well into the future. COVID-19 has brought extraordinary challenges to Canadians wherever they might live. No more important is the challenges that's placed on our public health care system. It's highlighted the gaps and the shortcomings in the existing formula and has led us to bring all of us together today to speak with one voice to the federal government about the challenges that we face today and in the future. If we look back over the development of Medicare and public health care in Canada, in the 1960s, we had a 50-50 cost share program put in place. By the 1970s, then Prime Minister Trudeau recognized, as did other premiers, that we needed to have a formula-driven system to put in place to make sure that we could manage the sustainability going forward. Again, in the 1990s and into the early 2000s, with the advent of the Romanow Commission, Canadians looked again at our public health care system, looking to continue to sustain it in the current and in the future. Here we are again at another critical pivot point in the future and the well-being of our public health care system. We have come together united, not because we have the same problems, but because we have one common purpose, and that is to protect and preserve public health care. If we can't look at this issue today in the midst of a global pandemic and plan the strategies for tomorrow, next year, and the next decade, we will not be able to meet the challenges as Mr. Legault has laid out for us so eloquently. I believe it's time now to make sure that all British Columbians and all Canadians understand that our public health care system is at risk. It defines who we are. We've seen that graphically over the past 12 months. Were it not for public health care, we wouldn't be in the envious position we are coming out of a pandemic, looking forward to a brighter, more prosperous future. But the costs of COVID-19 are not just today, they'll be for the long term. We have not any idea yet what the long-term costs will be for those who will suffer long-term symptoms from COVID-19. We do not know yet what the cost will be to catch up on the surgeries that have been delayed. Here in British Columbia, in the next 10 years, 1 in 4 British Columbians will be over 65. The impact that will have on our long-term care facilities is profound. We need to develop new programs and new policies for the 21st century. I know the federal government is receptive to these dialogues. I know the federal government is acknowledging the problem. We are here today to say to the federal government, we need to address this issue now in this federal budget so that we can plan here in British Columbia and across the country for the challenges that we all face. I want to thank the federal government for the contributions they have made over the past 12 months. They have been life-saving for businesses, for people, and for communities. But that is a one-time, short-term fix to what has always been a long-term problem. Since I joined the Council of Federation in 2017, every conference we have has focused on the health transfer. And so before COVID, we recognized the challenge. COVID has brought it into graphic light. It's stark, it's profound, and we need to take action. We're here today appealing from every corner of the country to our federal government to acknowledge that in the coming budget. If they do so, Canadians will be grateful, because this is not about governments, it's not about orders, it's not about fiscal federalism, it's about services for people. And the only way we're going to meet the expectations, the legitimately high expectations of the citizens that we serve, is by having a cost-sharing formula that's closer to 50-50 rather than 78-22.
Thank you, Premier Horgan. And now it's time for Premier Kenney from Alberta.
Thank you very much, and thank you, merci François d'avoir organisé cette conférence de presse. I want to join on behalf of Alberta, my colleagues from coast to coast, in calling for fairness in health funding. One of the reasons I understand the federal government has wanted to modify, reduce its share of healthcare funding is because for many years, provinces did let health inflation run sometimes out of control. There were year over year huge increases in spending, and understandably the federal government took a position that it had to see greater spending control efforts on the part of the provinces. I think that was an entirely reasonable position, but we have seen those efforts. I can say that here in Alberta, we've made some really tough decisions. We've just gone through a year of difficult discussions with our medical association representing our great physicians, coming to a tentative agreement that will effectively control future increases in spending in that area. We're finding savings all throughout our healthcare system, making very difficult decisions in the process. But even in that context, we've had to increase our budget for surgeries by $1 billion above and beyond the COVID crisis, and add hundreds of millions of dollars to address the mental health and addictions crisis that we've been living through here in this province. So even with extraordinarily difficult efforts to control spending, we still have to spend more to address an aging population and a growing population. And the federal government is not participating. It's not helping us carry that burden, even though it has much greater fiscal debt. Now, of course, through much of our modern history, through the past 40 years, Alberta has had the greatest fiscal capacity of the provinces, but that's no longer the case. With 5 years of economic adversity and stagnation, with the collapse of energy prices last year, we are posting record deficits, and we do not have unlimited resources. We want to be able to continue to share with the rest of the country, but for that part of the bargain to work, We need the federal government to do its part of the entire balance within the federation. If the federal government wants to say that it's playing a meaningful role in healthcare, then this is the opportunity to do so in this upcoming budget, in the COVID context, when health matters more than ever. So I do join my colleagues in right across the geographic and political spectrum in this federation and calling for fairness in federal funding for healthcare.
Thank you, Premier Kenney. Now, Premier Scott Moe.
Thank you very much, and I'm pleased to be participating with my colleagues across the country in this very critical discussion at this very critical time. And I agree with Premier Kenney. This is an opportunity for the federal government to participate to a much higher level and a more equitable level in providing health care for Canadians from coast to coast to coast. Ladies and gentlemen, there is no doubt that the pandemic has put an unprecedented strain on our healthcare systems across Canada. We have seen a heroic response from those working in healthcare, in particular those that are working on the front lines of our healthcare facilities. They have stepped up day after day after day, often at times with a great degree of risk to themselves personally. And they have done this to care and to protect for the ones that we love, for our family members. And we are very grateful for their professionalism, for their courage, and for their commitment. At the same time, we have seen patients and families struggling during this pandemic. Some are dealing, yes, directly with the COVID-19 virus and its ultimate impact. Others are waiting, often in pain and frustration, for surgeries, for procedures, for other tests that have been delayed in our healthcare system due to COVID-19. But the challenge of our healthcare system is experiencing today are not solely due to the pandemic. Healthcare across Canada was under pressure prior to the arrival of the COVID-19 virus, and we need to address those pressures, and we need to do so immediately. And that speaks to the opportunity that we have before us here today, because quite frankly, Canadians deserve better. Canadians deserve a healthcare system that is there when they need it, a system that is well funded and is supported by both levels, both orders of government in this nation, not one that is propped up by entirely by the provinces and the territories. And it should not take a pandemic to get us to this point. It shouldn't take a pandemic to get the attention of the federal government on this important topic. The fact is that premiers have been pleading with the federal government for literally decades now to come to the table as a full funding partner. But year after year, decade after decade, the federal share of healthcare funding in this country, it has continued to shrink. Today, provinces and territories cover close to 80% of all of the healthcare costs that is delivered to Canadians, while providing 100% of the healthcare delivery services. The federal government will talk about strategies and standards and other agreements, but these are, to this point, for the most part, just words. What we need is funding to be able to provide the very best core health care that we can to our citizens. I'll provide you an example of one of the challenges that we have here in Saskatchewan, an example in the impact to Saskatchewan citizens and ultimately families. Prior to COVID-19, Saskatchewan was committed to achieving a maximum 3-month wait time in our surgery wait times by the year 2030. And we still want to get there, but we aren't able to do that alone now, particularly when the province covers about 78% of all the healthcare costs, including those in surgeries. In March of 2020, we canceled all elective surgeries, except for the most urgent procedures, and that was due to the COVID-19 pandemic. That allowed our surgical wait list to climb up to about 30,000 people. That's 30,000 families that are waiting for a loved one to have their surgery here in the province. It's an extremely difficult decision to make, to pull back on those surgeries last spring, and we knew it would have a direct impact on people's lives. As I said, our wait time has increased by about 20%. But since March, we're down about 19,000 surgeries compared to last year. The number of patients that are now waiting longer than 6 months has grown to about 81% of patients. And again, those are family members that are waiting. And the number of patients that are waiting more than 12 months is over 200% higher than it was just a year ago. And that is the impact of COVID on families in our province and quite likely across the nation. Saskatchewan is committed to continuing to address the backlog of surgeries that we are experiencing here and reaching our pre-COVID wait time targets that we had, and we're committed to doing that as soon as possible. But this is going to require a significant investment in the tens of millions of dollars in each of the next 3, 4, and 5 years. And this is at a time when our economy is still recovering from this pandemic that we have all experienced in Canada and around the world. And in the meantime, we have citizens, Canadian citizens, that are continuing to wait, and they suffer often from the impact of these delayed surgical opportunities. This is unacceptable, and all the more because we feel it is most certainly avoidable. We can fix this if we work in partnership in this nation. It's time for the federal government to join the provinces and the territories to create a health system that responds to the needs of all Canadians, a healthcare system that is patient-centered, not just pandemic-centered. Thank you.
Thank you. Premier Brian Pallister from Manitoba.
It's an honor and privilege to speak to you from the Manitoba Legislative Assembly on Treaty 1 land and the homeland of the Métis Nation, and to tell you that I think the biggest problem that Canadians can relate to and understand as a consequence of our failure to get this partnership established and strengthened is the wait times that Canadians are enduring. According to the Canadian Institute of Health Information, before COVID struck us, the wait times had grown in the last 20 years by about 2.5 times, meaning you used to wait from general practitioner to treatment about 2 months. Now you wait closer to 6 months. That is unacceptable. Those personal impacts are very, very real. And if you yourself aren't waiting for a test or treatment right now, I expect you know someone who is, and you know how painful and how vulnerable that experience may make people feel. The 1 million+ Canadians that are waiting right now know, and the empathy needs to be felt by all of us. At my first opportunity as a newly elected premier half a decade ago at a premier's meeting, I raised the example with the Prime Minister of a young woman who felt a lump in her breast and then realized that she was frightened immediately, and they then decided that they needed to consult with a general practitioner. They waited. Every day they waited was painful. Every day for her children, for her partner, was full of fear. And then they were referred to a specialist, and they waited again. And then they were referred to a test by the specialist and waited again. And then they waited for the result of the test. And then they sat down with the specialist, who looked across the table at this couple and said to her, "It's too bad we couldn't have caught this sooner." That's the problem on an individual level that we're facing. We're losing people because of our failure to get health care to people sooner. And we need to change that. When I raised this story, a true story, with the Prime Minister, he looked across the table at me and said, "I'm not your banker. I don't need a banker." We don't need a banker. Canadians don't need a banker. We need a partner. We need a partner on health care. This isn't the Prime Minister's fault, except if he ignores the problem, and then it becomes his fault. And all of us will pay the price for that. We need a Prime Minister who understands the impact this is having on hundreds of thousands of Canadians every single day. We have had a partnership federally and provincially during this pandemic, and I think it's demonstrated to all of us, I hope it has to all Canadians, how effectively this confederation can work when people commit to supporting one another in a genuine way. We need to do that same thing now. We don't need a banker, we need a partner. And the lengthening waits over the past 2 decades are only going to worsen as Canada's population ages, as the needs of a growing population, a growing Indigenous population, are going to be very real and present themselves in abundance. The after effects of COVID will make a bad situation much, much worse if they are ignored. So I say to my friends across the country and on this call that the post-pandemic pileup is coming, and it's real, and its impact on Canadians and their families and their friends is real too. The time is now. The time was 5 years ago, but the time is now to address this issue and to address it together. Thank you.
Thank you. Premier Doug Ford from Ontario.
fact, funding for our health system has hit all-time highs. These investments have supported our frontline heroes. They've helped keep our people safe. Now, as we're waiting to get more supply from the federal government, we're laser focused on getting vaccines into arms. Yesterday alone, Ontario administered over 30,000 doses, a new daily record. That's 30,000 more people who are better protected against this awful virus. Friends, when we finally turn the corner on this pandemic, there'll be two top priorities ahead of all Canadians. We need to rebuild our economy and restore our health system. Ontario is already laying the groundwork to jumpstart our economy. But mending a health system that's already stretched to its limit will be no easy task. Wait times for backlog surgeries are growing. That means more people waiting longer for key surgeries, waiting longer for cataract surgeries, waiting longer for knee replacements. And too many people are struggling with their mental health. And our long-term care homes, neglected for decades, are in desperate need of more support. But folks, here's the good news. If the federal government works with the provinces, if Team Canada comes together, there's nothing we can't do. My friends, a lot of numbers get thrown around when we talk about the Canadian health transfer. But let me make this very clear for Canadians by looking at long-term care. For every long-term care resident, Ontario provides $76,000 each year and growing. The federal government's latest proposal would only provide $2,500. You heard me right, $2,500. The math doesn't work. In Ontario alone, 40,000 seniors are waiting for long-term care beds. We're adding beds as fast as we can. In fact, we expect 30,000 more beds starting in 2022. And we're the first province in Canada to commit to providing 4 hours of care to residents. But meeting this commitment will take time as we recruit and train more nurses and personal support workers. Just imagine what we could do together if the federal government stepped up as a true funding partner. We could build beds faster. We could train an army of nurses and PSWs that much sooner. Canadians can't keep waiting for better health care. Make no mistake, Ontario will always do whatever is needed to protect our people's health and well-being. And as you've heard from my fellow premiers today, they're also doing everything in their power to protect their residents and improve health care in their provinces. But the reality is, no province can do this alone. And now more than ever, we need national unity. We need to be united as a country when it comes to fixing healthcare for all Canadians. Because rebuilding after a once-in-a-century pandemic requires all hands on deck. So I'm proud to join my fellow premiers today to ask the Prime Minister to do what's right and call on the federal government to increase its share of the total healthcare spending to 35% and to maintain this level over time with a minimum annual escalator of at least 5%. It's time for the Prime Minister to step up, to work with the provinces and become a true funding partner. Because when Team Canada works together, nothing can stop us. Thank you, and God bless the people of Canada.
Thank you. And Premier Glenn Hicks from New Brunswick.
Thank you. First of all, I want to say that I too have very much appreciated the Government of Canada's support throughout this pandemic. However, the Prime Minister has told Canadians that federal funding for healthcare must be increased, but not right now. He says we should wait until the COVID-19 pandemic has ended before negotiating new funding arrangements for healthcare. If this is not the time to talk about healthcare, when would that be? Les gens de New Brunswick ne peuvent pas
New Brunswick cannot wait to have better healthcare services. Canadians cannot wait. They should see and know that their services, their health services are trustable, and they will be there when they need them there.
For healthcare in Canada. An immediate increase in the Canada Health Transfer will enable provinces and territories to maintain and secure current services during this pandemic, but also prepare for the challenge that an aging population will bring. We know that the Canadian society is aging, but the pace of this change differs from province to province. New Brunswick population and that of my neighboring Atlantic provinces are aging at a faster pace than all other provinces. An older population means more people requiring more healthcare services. New Brunswick is already seeing the impact of this change. We are falling behind other jurisdictions in our ability to provide important healthcare services. Only 45% of New Brunswickers can currently receive a hip and knee replacement within 6 months, compared to 72% for all of Canada. We are currently investing significant dollars to get to the national standard. We are focused on delivering quality of aging care services that exceed national standards and allow seniors to live where they want to and live there longer. We must recruit and retain the next generation of doctors, nurses, and other healthcare professionals who will deliver these services and care for our people. Most importantly, we must ensure equal standard of care exists across this country, because that is the intent of the Canada Health Act. Puisque cette vague démographique va frapper le Nouveau-Brunswick,
since this demographic wave will hit
de nos personnes âgées,
to ensure
tous continuer à vivre dans la dignité, en sachant que leurs besoins en matière
knowing that their material needs, their health material needs, will be satisfied.
Isn't the only challenge we're facing. There are so many others, including the increasing demand for mental health care. Just recently, a 16-year-old girl in our province took her own life after she was unable to access the services that she needed. The federal government needs to invest in healthcare for Canadians in a way that allows each province and territory to fulfill their obligation to deal most effectively with the challenges that each of us face. The federal government has demonstrated the fiscal capacity to make these investments just as they have done throughout the COVID-19 pandemic.
The next federal budget will be an opportunity to renew our financial needs and to get health services for Canadians, for now and for the years coming. Canadians cannot wait.
We need to have stability, consistency, and reliability in long-term care of our Canadian citizens. This obligation is so much more than a political statement, and every provincial and territorial leader are fully aligned on this request. This is about protecting what Canadians value more than anything else, our national healthcare system. Thank you. Merci.
Merci. Et un mot de conclusion du Premier ministre du Québec.
Oui, donc je veux remercier.
So I just want to thank my colleagues, premiers from the other provinces and territories, for accepting to deliver this message that is, again, unanimous today. We all have the same priority, which is to fund healthcare services in a correct fashion. It is a priority not only of the premiers, but the priority of our citizens. The demand, the request is clear. The federal government must do more. It has the means to do more. And we're asking for the federal government's contribution move from 22% for healthcare services and spendings to 35% of those spendings.
My colleagues from provinces and territories, the message for the federal government is clear, and it comes from coast to coast. Our health system faces a financial problem, a major financial problem, and the federal government has the solution. We must increase health transfer from the federal government from 22% to 35%. Ottawa can and must do its part. Thank you. Merci.